Thanks for coming to this press conference. We all know that seniors are at a significantly increased risk of severe disease if they are infected with COVID-19. Globally, about 80% of COVID-19 deaths occurred in those older than 60 years old. In Singapore, we see the same trends. Our death rates from COVID-19 are low, but among these, those 60 and above account for the vast majority. 90% of all COVID deaths here are seniors. Nearly 1 in 6 seniors developed severe symptoms and needed intensive care in the hospital. It is therefore critical that we make extra efforts to protect our seniors. Even as we cautiously lift some circuit breaker measures, we will continue to put in place enhanced safeguards where necessary, especially for vulnerable groups like our seniors. We have not seen widespread COVID-19 outbreaks in our nursing homes locally, but we cannot let our guards down. Since January this year, the Ministry of Health and the Agency for Integrated Care, AIC, have worked with the nursing homes on a range of safeguards. As a further precautionary measure, homes serving the elderly have arranged for client-facing staff to stay at designated accommodation facilities on-site or at hotels during the circuit breaker period. About 2,600 nursing home staff are in the process of moving into hotels. I would like to thank the affected staff for their understanding for the inconveniences they undoubtedly have to face to keep our seniors safe. Testing is an important strategy to detect COVID-19 infections amongst our vulnerable groups as early as possible to limit further transmission. We will test all staff and residents of nursing homes with symptoms of acute respiratory infection. New residents are also tested prior to admission. In addition, since 29th April, we have initiated testing for all 9,000 staff and 16,000 residents of the 80 nursing homes in Singapore. Of the 9,000 staff tested, all were negative for COVID-19 except for one staff in Renci at Ang Mo Kio. We have tested more than 30 residents who could be in contact with the staff, as well as those who have acute respiratory symptoms. Their tests are negative. Renci will continue to monitor them. We will progressively test all 16,000 nursing home residents, and we expect to complete this by early June. We expect that more cases will be identified within our nursing homes with this extensive testing in progress. Where there is a positive case, Ministry of Health and AIC will support the nursing home to thoroughly disinfect the affected areas, conduct contact tracing, and quarantine close contacts. Minister Desmond Lee will share more about what is being done in other residential care homes serving the elderly. Beyond nursing homes, we also want to take good care of our seniors in the community and give them a helping hand during this circuit breaker period. Safe distancing does not mean social isolation for our seniors. The Civil Generation Office has proactively checked in on our seniors with weak family support and referred them to relevant support services, including befriending where necessary. I'm also happy to know that many of our seniors are staying in touch with their family members and friends through phone and video calls. Many have also taken to social media to stay in touch. Since 5th of May 2020, some 130 traditional Chinese medicine medical halls with registered TCM practitioners have been allowed to sell retail products on top of the consultation and herbal dispensary services which they were already allowed to provide. We have received feedback from some seniors that they purchase medicine also from TCM medical halls and find it inconvenient if they have to travel far to these halls. A Member of Parliament, Lee Bee-Hua, also raised this issue in Parliament this week, and I had promised her that I would take her feedback seriously. Indeed, I have asked the Ministry of Health to do a review, and I'm happy to share that from 12th May, all TCM medical halls will be allowed to sell retail products. This will provide more convenience, especially to our seniors. However, the medical halls must put in place the necessary safe management measures before commencing operations, as they serve many seniors. Let us work together to keep our seniors safe. Let us keep up our good habits, such as safe distancing, personal hygiene, and wearing of masks. Avoid interacting with seniors if you are unwell. Together, we can protect them from the infection. Let me say a few words in Mandarin. 我们都知道，年长者一旦感染冠状病毒，比其他的人可能病情会较严重。全球至今因冠病病逝的人当中，至少80%的年龄超过60岁。本地的趋势也一样，所以我们需要采取额外的措施来保护我们当中的年长者。接着下来的几个星期，我们在谨慎地解除一些阻断措施的时候，还是会在必要的时候加强一些对年长者的防范措施。本地的疗养院至今没有出现大规模的疫情爆发情况，但我们不能掉以轻心。从今年1月开始，卫生部和互联中心 AIC 与本地的疗养院合作，已经实施了一系列的防范措施。我们将实施额外的防范措施。疗养院已经安排那些在工作上会接触到疗养院住户的员工，在这段时间住进一些特定的酒店。目前大约有2600名员工已经陆续的住进酒店。我要在这里感谢这些员工，为了保护我们的年长者，他们做出了一些牺牲，在生活上也造成一些不便。要确保病毒不会进一步的传播，检测是一个非常重要的对策，能让我们尽早的测出弱势群体里面有没有人染病。所有的疗养院员工和住户，如果出现急性呼吸道疾病的症状，我们都会进行病毒检测。新住户在搬进疗养院之前也会接受检测。从4月29号开始，我们已经开始对本地80家疗养院的9000名员工以及16000名住户进行检测。完成检测的9000名员工当中，除了1名在仁慈红帽桥疗养院工作的员工，其他员工检测的结果都呈阴性。我们也已经检测了超过30名可能与这个员工有过接触的住户和员工，以及有急性呼吸道症状的住户，他们的检测结果也都是阴性的。仁慈疗养院会继续观察他们的情况。我们也将会逐步检测所有16000名的住户，预计能在6月初完成检测的工作。因为我们大规模的进行检测，我们预料接下来或会有更多疗养院的病例出现。李志胜部长接着下来会讲解更多在其他疗养院的养老院的行动。除了疗养院，我们也必须好好的照顾在社区里的年长者，在阻断措施实行的这个期间，向他们伸出援手。关爱乐龄办事处 AIC SGO 也已经积极的联系了一些缺乏家庭支持、需要帮助的年长者，来帮助他们向一些机构团队求助，包括寻找友伴等。大约有130家有注册的中医坐诊的中药行，从这个星期二5月5号开始，已经被允许售卖零售商品。这些中药行之前已经被准许提供问诊和配药服务。有些年长者回馈说，他们需要到中药行买中药，如果要长途跋涉到别的地方购买，会很麻烦。李美花议员星期二也在国会提出这个情况，我当时向他保证，我会认真的看待他的建议。我和卫生部的同事也已经检讨了这个情况，我想我们可以进一步的放宽。所有中药行从5月12日开始， 可以允许售卖零售商品，但是由于这些中药行服务很多的年长者，所以在他们实行开始售卖之前，必须实行有必要的安全措施，做好十足的准备。保护年长者的安全，人人有责。只要我们齐心努力，就能够保护我们当中的弱势群体。Now, I would like to invite the Director of Medical Services to give an update on the medical situation.
Thank you, Minister. As of the 8th of May, 2020, 12 noon, the Ministry of Health has preliminarily confirmed an additional 768 cases of COVID-19 infection in Singapore, and the vast majority of these are work permit holders residing in foreign worker dormitories. 10 cases are Singaporeans or permanent residents. We're still working through the rest of the details of the cases, and further information will be provided via the press release that the Ministry of Health will issue later tonight.
I would like to invite Minister Desmond Lee to give an update.
Good afternoon. As Mr. Gan had reiterated, seniors in the community as well as seniors in our residential facilities are most at risk because if infected with COVID-19, they tend to fare poorly. We've therefore been paying extra attention to seniors because of this higher risk of developing serious health complications if infected. And it is therefore important for seniors to try to stay home as much as possible. Younger members of the family should help out by arranging for grocery shopping and running of errands for seniors. And if you don't live with your parents, you can arrange for contactless grocery delivery, or you can buy for them and leave it at the door without putting them at risk through interaction with them. You can also take care of their emotional and mental well-being by calling our seniors often and keeping in touch with them. Let me give an update on seniors living in residential homes, as well as vulnerable seniors and isolated seniors. Let me start off with seniors living in residential homes under MSF's charge. Since late January, we've been tightening precautionary measures to strengthen the protection of seniors living in residential and community-based facilities. These include welfare homes, sheltered homes, and adult disability homes, amongst others. MSF completed a proactive swabbing of 4,600 staff and residents of some 34 homes that are funded by MSF on the 2nd of May 2020. 3,250 of these are residents and 1,300 of them are staff. Thus far, most of the returns have come back and they've been negative. These homes have not allowed visitors since the 3rd of April, when we tightened precautionary measures for everyone's safety as part of the enhanced circuit breaker measures. And to further reduce the risk of virus infection into residential homes for seniors, we have arranged for all care staff to either move on site into the homes or to stay in designated hotels. And this is to minimize their community social interactions and reduce the risk posed to our care staff, and therefore reduce the risk to residential homes. About 700 staff working in MSF-funded residential homes will live on-site in the facilities, and about 400 will move to hotels. The movement of staff started on the 4th of May, Monday, and will complete by next Monday, the 11th of May. Like Minister Gan, I'm deeply appreciative to the staff of the residential homes for this big sacrifice, for staying away from family, and for putting the well-being and welfare of the senior residents above their own. And just as what our homes have been doing since January, any staff or resident who displays symptoms will be immediately isolated and given medical attention. Now, on the 27th of April, MOH announced that there was a cluster of 15 positive COVID cases at Acacia Home, which is a welfare home run by Satya Sai Social Services and funded by MSF. 13 of them are residents and 2 of them are staff. One resident has since fully recovered and has returned to Acacia Home. Today, one of the residents on quarantine had just been tested positive for COVID-19, and this is near the tail end of the 14-day period. We have tested everyone else living in Acacia Home and working at the home, including contractors who have been there for essential purposes in the past 4 weeks. And those who tested negative are now under quarantine orders, and their health is being monitored closely. So that is regarding seniors living in residential homes. Let me now move to the broader support for seniors living in the community, in particular, seniors who are vulnerable and seniors who are isolated. Now, since the circuit breaker began, the National Council of Social Service has coordinated with volunteer groups and ground-up community partners to ensure that essential aid continues to be provided to those in need, including vulnerable seniors, while minimizing movement and interaction of people on the ground. This network has been distributing meals, surgical masks, disinfectants, sanitizers, exercise bands, telecommunication equipment, SIM cards, and so on. And through these distributions, the volunteers take the opportunity to guide seniors on the necessary precautions that need to be taken, such as frequent hand washing, and checking if the seniors need any other assistance, such as transport to their medical appointments. During the extended circuit breaker period, we have worked with several social service agencies to partner government departments such as HDB and LTA to undertake joint safe distancing patrols. So if they encounter seniors who are out and about, they will guide them to wear a mask and stay at home as much as possible. Should our safe distancing ambassadors and enforcement officers identify seniors who may require further assistance because they may have some underlying issues that prevent them from staying at home, or if they have mental health issues, they'll be referred to the relevant agencies for further support, including to AIC for follow-up. For those seniors who are homeless and rough sleeping, under the Peers Network, our partner agencies will refer them to safe, sound sleeping places for shelter, offer help and assistance to them, and MSF will work with the relevant agencies to look at their housing issues going forward. Minister Gan spoke briefly about agencies' efforts to keep in touch with seniors to ensure that while they may live alone, they are not isolated. Let me give a little bit more detail on those efforts. The Silver Generation Office, or SGO, has been calling vulnerable seniors to ensure that they're informed of the latest developments and also to check in on their well-being and on their needs. They've reached out in this way to about 19,000 seniors living alone and will continue to regularly call to support them. These include seniors who live alone with weak social support, as well as empty nesters with weak social and family support. The seniors who were engaged in this way were receptive. Most seniors expressed that they were coping well with the current situation, but some expressed concern and uncertainty about the COVID-19 pandemic. And following up from these calls, SGO is working with some 450 public service volunteers to run errands for these seniors who require assistance outside the home during this period. And some 1,200 seniors have requested for assistance and are being helped in this way for meal deliveries, financial assistance, and befriending services. It's important that our seniors are updated and are aware of what is going on. So if you or any other community group knows of any senior in your neighborhood who could use with a friendly check-in every now and then, please do reach out to them or let us know. The hotline for the Agency for Integrated Care is 1-800-650-6060. And for those who may need psychological and emotional support, the 24-hour National Care Hotline is 1-800-202-6868. This hotline is manned by professionals, including psychologists, counselors, and public service officers trained in psychological first aid. And when I spoke to some of the care hotline officers earlier today, they shared with me that some seniors called and expressed concern about the ongoing situation and needed help through befriending. There are also other activities, such as on television and online, that can help our seniors keep engaged and active, such as the National Silver Academy courses online and the Health Promotion Board exercises, which are online. And I encourage family members, especially younger family members, to ensure that this is set up and available to our seniors. MOH, MSF, AIC, and the National Council of Social Service, as well as our many community partners, will continue to coordinate efforts across the health, social, and community care sectors to ensure that our seniors and the vulnerable, both in the community and in our residential facilities, receive the necessary support and assistance with appropriate safe distancing measures put in place. Together, we can emerge from this crisis and take care of all our seniors.
Good evening, everyone. Let me just wrap up by giving an update on where we are in this crisis. We are continuing to fight the virus on two major fronts, as we have described. Firstly, in controlling the outbreak in the migrant worker dormitories, and secondly, to control the outbreak in the broader community. For the migrant worker dormitories, the situation in the purpose-built dormitories is stabilizing, but we are still taking time to clear the many other dormitories we have in Singapore, especially the smaller factory-converted dormitories. So each day, the numbers are still high, partly because of our active and aggressive testing regime, which we have put in place, and we are continuing to test more migrant workers every day. So we expect to still see these numbers for a few more weeks before they stabilize. But our strategy is working, and we are making progress day by day in clearing these dormitories. We are also very mindful of the people who are working in the dormitories and also the community care facilities. In recent days, we have picked up a few cases of people working in these settings who have become infected. And so we are not only, we already have precautions in these settings, but we are doing more now by also testing the workers who are working in these settings, not just once, but again, periodically, just to ensure that these workers can do their work in a safe environment. At the community level, you know the numbers that we have been reporting every day. They have been coming down. I think the average in the past week was about 10 a day. The number of unlinked cases have also come down. And importantly, if you look at the surveillance program which we have put in place to test cases in our clinics with prolonged acute respiratory illness, those number of cases have also been coming down, which suggests that the number of unlinked cases in our community is lower than it used to be in the recent weeks. So we are making progress because of the circuit breaker, and we should continue to do our part to comply with the measures for the rest of the circuit breaker period. We should remain vigilant and not take any chances. All of you would know that we have made some announcements on some easing of measures from the 12th of May onwards, but that should not be an opportunity for us to go out and more frequently. Right? For the businesses themselves, first of all, do not be in a rush to reopen your business and neglect the important safe management practices that you have to put in place first. In fact, if the safe management practices are not ready, then please do not just rush to reopen the business on the 12th of May, because our inspectors will be going around to check and to enforce. And if you are not ready, if the business premise doesn't have the necessary precautions and safeguards in place, then we may have to ask you to stop work anyway, and there will be penalties imposed. For individuals, again, there is no need to rush to go out to patronize these businesses on the 12th of May. I know some people may not have had a haircut for some time, but there is no need to rush to go out to have a haircut on the 12th of May. There will be time to do so, right? So let's pace ourselves. Don't rush to go out quickly just because of the easing of some restrictions. The circuit breaker is still in place, and we should make the most of this next 3 weeks and more through the circuit breaker period to bring our community numbers down as much as possible. In the meantime, let us also, as we are focusing on today, in today's press conference, do everything we can to protect our seniors because they are the most vulnerable group. So if you are living with an elderly person in the same household, then encourage that person not to go out and try to run errands on their behalf. If you are not living together, but your parents or grandparents are living separately from you, then make use of this opportunity to stay in touch with them remotely, call them. A physical separation doesn't mean that they have to be emotionally isolated. Mother's Day is coming on Sunday, for example. So remember to call your mother, your grandmother, and use this opportunity to be in touch with them. Don't visit them because that would be an activity that we don't want to encourage, because whenever you visit, have physical contact, that can bring some risk to the elderly. But do call them, check on them regularly, and continue to show our appreciation to our seniors, because we all know that during this circuit breaker period, many of them do feel isolated because they are away from their children and grandchildren. So we, as I said just now, have about three over weeks before the circuit breaker period comes to an end on the 1st of June. We will, as we have described, continue to monitor, assess the situation in thinking about what to do post 1st June. Whatever the decision or whatever happens in the coming days or weeks, it is clearly not going to be the case that after 1st of June, everything will be lifted and we will go back to status quo ante. That is clearly not going to happen. So all of us have to be mentally prepared that the scenario post 1st June will continue to be one of gradual, calibrated easing. Exactly how much we'll have to see depending on the assessment of the situation in the coming days and weeks. And as we assess that and are ready, we will let Singaporeans know more details about how we can, about the exact nature of the restrictions or the easing that one can expect post 1st June. But in the meantime, like I said earlier, let us continue to hunker down and do everything we can to stay home, minimize our contacts with others, and make the most of the circuit breaker period. Thank you.
Thank you. Questions from the floor?
Thank you, panelists. Media members, please remember to use the raise hand button if you'd like to ask a question. Please only ask one question to allow more to participate in the Q&A. The first question we have is from Yun Zhou from Zabao. So,
good afternoon, ministers. We have a question over here on the community care facilities and also the foreign worker dormitories, workers and volunteers who have been tested positive in the past few days. Is there anything apart from the testing that Minister also mentioned just now, apart from testing, is there anything else we can do to prevent a further surge? And also, how are we ensuring the safety of these workers and volunteers? Would the operations and the numbers at these facilities be affected also? Thank you.
I'll ask the DMS to elaborate on a bit of details, but broadly, we are at the moment investigating into the various positive cases. better understand how the transmission could have happened, whether it was infected from the patients or they were infected because of a staff interaction or any other possible source of infection. With a better understanding of the way the transmission happens, that will allow us to decide what additional measures we need to put in place. Concurrently, we are also doing a review of some of these operations to see whether there are still gaps in our infection control measures that we have already put in place, whether we need to tighten some of them, whether we need to close some of the gaps further. We are also taking this opportunity to remind all the workers on the ground, including healthcare workers as well as non-healthcare workers. You would imagine that there are also security personnel, there are also cleaners, administrators who go in and out of these facilities to administer to manage the facilities. So all these are potential risk areas. We are also taking a review and to also remind them and refresh their knowledge about infection control. So I think we are doing this on multiple fronts. The idea is to enhance our protection of our workers so that they are able to work in a safe place. I'll ask DMS to elaborate further.
Indeed, Minister is correct. We have been very concerned about the number of staff and supporting staff who have been diagnosed to have COVID-19 infection and who have been involved in dormitory operations. And they fall into a variety of different settings. We do know that there are a few members of the support staff involved with ensuring that the dormitory services continue during this period of time when the dormitories are locked down. And we want to make sure that for each of them, that they, in fact, were properly trained in the use of their personal protective equipment, their mask, and that they were obeying and respecting the infection control measures that they were supposed to obey and follow in order to make sure that they were properly protected. We are engaging with the interagency task force in this manner, and we want to make sure that all of them are competent and fully understand what they're supposed to do to protect themselves. And if needed, we will work with the interagency task force on refresher training, as well as having staff carry out inspections to watch over each other to make sure that, in fact, everyone is doing the right thing. We are particularly concerned also for our healthcare workers involved in the support of foreign workers at this point in time. And our medical teams are involved in dormitory operations across many different settings, not just at the dormitories themselves, but also at our community facilities, whether it's in the community care facilities or community recovery facilities. And in these areas, we are working with the various medical teams as well as their regional health systems and hospitals where they come from to make sure that all the necessary preventive and protective measures are put in place. There's also some level of process improvement that's taking place. For example, the use of barriers, physical distancing is being enhanced at this point in time just to further protect the staff that are involved in these operations. We are particularly mindful that while staff may be very disciplined in the use of protective equipment during their work periods, they must be equally vigilant also during the periods when they're off work cycles, for example, during their breaks. And we are making sure that the message for them to continue with their safe distancing measures and infection control measures continues even during those off-work periods during their breaks as well. So we are continuing to work to improve our processes, continuing to exercise vigilance, working with the people on the ground, working with the interagency task force to make sure that we don't leave any stone unturned to protect all staff, whether they're healthcare workers, support staff in the dormitories, to make sure that they all are compliant with the measures that are designed to protect them so as to prevent them from also getting further infected.
Thank you, panelists. The next question is from Jalila of CNA. Jalila?
Thank you. Just want to ask that, so even with the circuit measures fully enforced, there is a small but steady number of new community cases each day. what are the expectations for when the circuit breaker is eased or lifted, and should we expect the number of community cases to rise significantly? Are you more concerned about unidentified infection in the community or leaks from places such as Expo and the dorms? Yeah, thanks.
So that's exactly why we are concerned that if the circuit breaker were to be lifted, the cases may indeed rise for whatever reasons. It could be hidden cases in the communities. It could be, as you say, cross-infection, spillover from existing non-clusters. So all the more reason, even as we approach the end of the circuit breaker and decide what the next steps will be, we have to do so cautiously if we want to ease any restrictions. The baseline protection will have to remain. Things like safe distancing measures, wearing of masks when you go out or at work, all of these will remain post 1st June. There's no doubt about that. Beyond these baseline measures, the extent to which we can do more reopening of workplaces, that's something that, again, as we have said, we will have to consider. How many more workplaces can be reopened? How many more workers can now resume going to work on a daily basis? We don't have the answer today. We don't have to decide now, but we can look at it as we approach the coming days and weeks, depending on our assessment of the situation. But regardless, it will not be a sudden opening up. It cannot be, right? So we will have to still take a cautious and calibrated approach. And as I mentioned earlier, even for the workplaces that we allow to open and resume work, the new ones post 1st June, and for the workers who are going to work on a regular basis, more precautions have to be taken than today. And that would include all the safe management practices that are required at the workplace premises. It would also include the use of technology. So the workplace premise would need to have safe entry. The worker as well, we will look at, we have talked about how we are enhancing the Trace Together app to make it more effective and looking at other technology solutions for those without smartphones. That work stream is still something we are focused on, so that by the time we get to post 1st June, we will have some solutions in place in order to have faster contact tracing happening, so that even if there were a case that emerges during that period, we will be able to do much faster contact tracing, identifying of the contacts around that person, and quickly issue quarantine orders, literally on an electronic platform, instantaneously. Right? So these are the things that we are doing so that we can enable some opening beyond the circuit breaker, but it will have to be done in a cautious and calibrated manner.
Thank you, Minister. The next question is from the Straits Times, Ray. Ray?
Hi, Ministers. My question is for the community care facilities and for the workers who have tested positive. Is there anything else that we can do to prevent a further surge apart from just testing? And how can we ensure the safety of the workers and volunteers? Can we get a sense of how the workers at these, the number of workers at these facilities will be tested?
I thought we just answered that question from Zhao Bao. So maybe BMS can quickly summarize what we mentioned earlier.
Yes, actually, we did answer a very similar question. We are very concerned, as I mentioned earlier, about making sure that our workers are protected, and we will be reviewing all the measures that they take at these sites to ensure that they are also up to speed and competent with their personal protective equipment use, and as well as infection control measures. You asked one additional question, which was on testing. We are testing staff on a regular basis to make sure also that they are not exposed to infection. And so far, that testing is going well. It's still in progress.
Thank you, DMS. The next question is from John from Reuters. John, please go ahead.
Thank you, Ministers and DMS. I just wanted to clarify a few numbers very quickly, if you don't mind, and then I'll ask my question. Could you just give me the numbers again on the plans to roll out the testing? You mentioned 9,000 staff and 16,000 residents of 80 nursing homes. Is that right? That's the plan for the coming weeks? And also, could you confirm, of the 20 fatalities we've had here, how many of them have been either residents or staff of care homes? And my question is, in the interest of protecting seniors, have you considered any other measures that some countries have mooted, such as perhaps allowing younger people to come out of circuit breaker measures first and extending the period that elderly people would perhaps face circuit breaker measures? Is that something that you would consider at this moment in time?
Maybe I will just clarify the numbers. Currently, we have 9,000 staff from the nursing homes that we have completed testing. We are progressing to test residents. We have 15,000 residents, 16,000 residents that we are going to begin to test. And that will take a few weeks, and we hope to be able to complete the testing of the 16,000 nursing home residents by the first part of early June. So I think that's testing progress. In terms of the mortality death case numbers, maybe DMS has the number.
I don't have the number with me right now, but the number of nursing home residents who have passed away, but we'll check that number and make that available to all of you.
On the circuit breaker, maybe ask Lawrence.
Just to also add to one point, 9,000 are staff, 15,000 are residents. These are nursing homes, 25,000, 16,000. So that's 25,000 altogether. But there are another 5,000 residents and staff in our welfare homes, sheltered homes, adult disability homes. Collectively, we call them residential care homes. And that's why in our statement, we give a figure combined of 30,000 residents and staff in these residential care facilities. Then on the next question of whether we would contemplate what you would call a vertical sort of protection strategy where you protect the seniors and allow the younger folks to go out to work, which some people have contemplated or talked about. The challenge in the Singapore context, and in fact in many Asian contexts, I think, is that we tend to have many multi-generational families. People living together with their parents and even their grandparents. So this idea that you can allow the young to go out to work and still protect the elderly falls apart, because the young will be out and about, but they will still go back and interact with their parents and grandparents at home. So it is going to be harder to do that in our context. I think in any Asian context where you have multiple generations living together. But certainly we can still make use of the idea, the principle that we do need to have more protection for seniors and apply it in different areas. So we are doing this in the residential care facilities, where we are doing more protection, more precautions, more testing, even to the extent of requiring the staff to stay on-site or in dedicated facilities. Next, we can also look at various work settings which are of higher risk. And then if there are seniors working in these settings, we can perhaps start to look at reassigning their roles so that their exposure to work to risk is reduced, or even to reassign them in different areas. So that's another second way we can think about doing this. And then thirdly, I think the baseline precaution that we will continue to emphasize is that for seniors who are not working, they should still do all they can to stay home, and we will probably have all the restrictions around social activities for seniors will likely remain in place for quite some time, until we are very confident of the precautions that can be taken in order to ensure that these activities are safe for seniors.
Thank you, panelists. Our next question is from Karishma from BBC. Karishma?
Hi there. Yeah, my question is about the resumption of economic and work activities. How much are you going to, in your Ministry of Trade said that companies would have to encourage employees to download the Trace Together app. Is this going to be become compulsory for employees in order for them to get back into the workplace? And are you going to roll out the Trace Together app in other parts of Singaporean life, at schools, for instance, with students who have the technology, to ensure that this is more widely rolled out across the country?
Thank you. The idea of having some sort of an application which will allow us to do fast contact tracing and track down the contacts of any individual who is a confirmed case or even a contact of contacts. That's something that we want to achieve as we reopen the economy. Exactly how to go about doing this, the technical teams are studying and exploring the best solution. Some of you might know that Apple and Google are themselves working on a protocol to enable this to happen on Android and iOS devices. Right? So that's a protocol that potentially will enhance the effectiveness of our Trace Together app. So the technical teams are discussing whether through Trace Together or through other applications that can allow for this fast contact tracing at scale to happen. And as I mentioned earlier, when we are ready with a solution, we will announce what that solution is, and we will indeed want everyone to have that solution in place. That the solution also could entail something that's outside of the phone, because not everyone has a smartphone. So we are also looking at possibilities like a wearable, a dongle that people can carry with them when they go out, so that for those without smartphones, the possibility of being able to track them remains for contact tracing purposes. So there are a few potential solutions that are being explored even right now. The technical teams are discussing intensively with Apple, with Google, with other tech providers. And when we are ready with a solution, we will explain what that solution is, and we will want everyone to take it up.
Thank you, Minister. The next question is from Janice from the Business Times. Janice?
Hi, sorry. Just a very quick question about this movement of staff of nursing homes and MSF homes to hotels. Can we just confirm that, including for the staff in nursing homes, this hotel bill will be picked up by MSF or the government?
Yes, it will.
Next question. So the answer to the question is yes, the government will foot the bill of this accommodation, because today they are either staying at their home or they are staying on-site. If they are staying on-site, they can continue to stay on-site, and some of them may need to move out from their homes and to be provided with additional accommodation. I think the cost of this additional alternative accommodation will be picked up by the government.
Can I just add that in addition to accommodation, we are arranging for daily transport from the hotel to work, and ensure that that transportation also assures them that they're kept safe throughout the journey. We also take care of their meals, take care of the other needs that they may have during this circuit breaker period.
Thank you. The next question is from Sumita of Mothership. Sumita? Sorry, hang on. Yeah.
So I just want to follow up on a question about the staff that are working at elderly care facilities. How long do the staff need to stay on site or in hotels for? And are there any arrangements that have been made for them to see their families during this period?
So the staff will reside in the residential facility or in the hotel until the conclusion of the circuit breaker period. Right, so for the next few weeks, they are making a big sacrifice to stay away from their families. We'll make arrangements for them to get the essentials, the food that they need, and they'll then be able to communicate and keep in touch with their families electronically.
Thank you. The next question is from Ishika from Bloomberg. Ishika?
Hi, I was just wondering whether you feel like the strategy of selective testing has not worked out as planned, and if you plan to move to mass testing, how that's going to be managed given the global shortage. Thank you.
Can you repeat the question? Sorry, the first part of it. Your voice was breaking up.
Sorry. Can you hear me?
Yes.
Okay. Do you feel like the strategy of selective testing has not worked out as well as planned? And if you are to move to mass testing, how are you going to manage given the global shortage of supplies?
Right.
Thank you.
Sure.
Actually, we hold a view that our selective testing strategies, in fact, have given us quite a bit of yield in terms of positive cases. It's not that the selective testing has not worked out. And at this point in time, we remained focused on continuing testing of populations that we deem at higher risk of getting infected, with a view towards trying to identify them quickly, isolate them, remove them from the setting in which they can potentially continue to circulate, mix with others, and to then potentially infect other people as well. We believe that that still remains a valid strategy in the setting which we're dealing with, where we are having vulnerable populations, and we are committed to continue with this selective and focused testing strategy. So it's not that it hasn't worked, but we believe that this continues to be a very important measure. As we move on, then eventually into a later period of time when we are also talking in terms of how we would normalize, then our testing strategies would also have to be adjusted in tandem with our plan to bring more people back into circulation, into work. And that will be something that we will continue to review, fine-tune, and decide how we would expand our testing strategies. So we've not made any major decisions just yet about embarking on mass testing, but certainly at this point in time, we believe that focused testing on subpopulations at risk in order to disrupt that chain of transmission, this still continues to make sense to us.
Can I just add that we have been raising our testing capacity to quite a large extent, and we announced earlier that we started out with about 2,900 tests per day, and now we are doing 8,000. In a few weeks' time, we might get to 20,000 a day, and our aim is 40,000 a day. For a population of the size of Singapore, 40,000 a day is probably ranks as one of the highest rate of testing in the world. But even with 40,000 a day, one has to decide how to allocate those tests. So when you say mass testing, even with 40,000 a day for a population the size of Singapore, it's not going to be effective if it is done in an uncoordinated way. So the tests that we have to be allocated to areas of priority. For example, we would want to have some tests allocated for regular community surveillance. So you pick up anyone with respiratory illness, you test them. That will take up some tests. Then you want to allocate some to the migrant workers. Even if the dorms are cleared, you want to test them on a regular basis, because we are concerned if, knowing the way the migrant workers, in terms of their work, particularly for the construction sector, the work environment and the fact that they are typically working in large groups, then you want to be very careful not to have large clusters forming again, right? So again, have to allocate some tests for the migrant workers to be tested on a regular basis. Next, you want to test the vulnerable sectors, like we've just talked about, nursing homes, the residents and the staff, healthcare workers with a community or high touch points with the community. Again, you want to allocate regular tests for this group of workers. We also want to test those on the front line of our COVID-19 operations who are caring for patients working in dormitories, and we want to allocate some tests for them as well. Beyond that, there are a whole range of people who will be commuting daily to work. Today, as we've said, about 15% of the workforce are doing so. We call them the essential workforce. But in the coming weeks and beyond 1st of June, that 15% will grow, maybe to 20% initially, and certainly beyond 20% after the 1st of June. And so some tests will have to be allocated to them as well. So when we talk about mass testing, it's not just everyone raise your hand and then you can apply for a test. It shouldn't be like that. It has to be directed. Testing will be a national resource which we will apply in a strategic way to ensure that Singapore is safe from the virus.
We're also using different methodologies to maximize the yield that we get from our testing across different settings. So while we are using individualized testing for the diagnosis of patients with symptoms that we suspect might be due to COVID-19 infection, but in other settings, particularly when the expectation is the risk of infection in that particular community to be low, we'll be using different strategies which include pooled testing, where we might batch several swabs for one single test to be performed on this small group of individuals as well. So there are a variety of different strategies that would be used depending on the setting. We might also be using other forms of tests, including serological tests, to determine, for example, whether groups of people have recovered from the infection and therefore could be safely returned into the community and returned back to work. So a variety of different testing approaches might be used depending on the setting, and that would help us to make sure that we get the best yield out of the tests that we have available as we continue to increase the capacity of tests that we have in Singapore.
Let me add that actually I spent quite a fair bit of time on Monday in Parliament to explain our strategy on testing. We cannot be testing aimlessly. So the key is that for the tests that we carry out, we do so with quite clear purposes in mind. There are actually three key main purposes. The first one is to identify the positive cases, those who are infected, so that we can provide treatment support and care, as well as to identify close contacts and quarantine them to prevent widespread transmission. That's the first objective, to identify those who are infected. Second objective is to do overall surveillance of the number of cases in the community and in the country. So these we do sampling. I think Minister Wong talked about testing those with influenza symptoms, those with respiratory symptoms. Those allow us to have a sense of overall, do we have a big problem? Do we have many cases in the community, or we just have isolated cases? Those are done in a sampling way to give us a sense of a surveillance outcome. The third objective is really, in fact, to look for those who are negative. That means we actually want workers to go back to work. We test them to make sure that they are negative so that they can go back to work. So the first one is to test to find those who are positive. The second one is to do surveillance to understand the overall landscape. The third one is to look for those who are negative to allow them to go back to work. Our test for our healthcare workers is one example in nursing home to make sure that they are negative so that they can go back to work. So I think there are different purposes. Each purpose has a different testing strategy. So when we test individuals, we need to know what is the purpose of the test so that we can design our strategy appropriately and the outcome will then be useful for us.
We have time for the last 3 questions. The next question is from Nicholas of Yahoo. Nicholas?
Hi. There have been a number of deaths, I believe 6 of them, which have not officially been attributed to COVID-19, even though the deceased all tested positive for the coronavirus. So just wondering, how is the cause of death determined? Isn't it by definition complications related to COVID-19?
Yes, so in relation to COVID-19 cases that unfortunately have passed on, our approach really is first to ask ourselves, is this directly attributable to COVID-19 infection or complications related to COVID-19 infection? In which case, if they are, we will report them as such, and this comes out in a press statement that comes out every day. In fact, we are quite transparent in announcing and reporting all the deaths that we have. Even if they were not due to COVID-19 infection, then they would be reported still, but we would not necessarily ascribe them to COVID-19 unless we have been informed by the medical authorities whether the doctors attending to the patient or the coroner, if these were made coroner's cases, if they were telling us directly that these were deaths attributable to COVID-19 infection, then we will be reporting them as such.
The next question is from Venga of Tamil Murasu. Venga?
Hi, yeah, Benga from Tamil Murase. So I have a quick question on the salary that's being given to workers. So I understand that a lot of them are not going to be working for the next few weeks or months, and but you know, I think the government has given the $750 levy waiver for this month and for the month of April. So are employers expected to pay their workers the salary in full? And for errant employers who are not doing so, what actions are being taken against them? Thank you.
Thank you. That's something that certainly we are watching out very carefully, because we know that the workers are very concerned about being paid and then to remit the money back home. So we have given not only a waiver of the foreign worker levy to the employers, but also a rebate of the levies that they had previously paid. And so we do expect the employers to pay their workers. And we had a press conference earlier with the Minister for Manpower where we talked about how we've been monitoring the statistics, which are the employers have perhaps been slow in doing so, and maybe because they themselves are facing difficulties, but no reason, because the rebate has been given, it ought to be a pass-through from the rebate to the salary to the workers directly. So we do expect all employers to follow up, and the Ministry of Manpower is watching over this very carefully and will take any actions against the errant employers who choose not to. So they are indeed monitoring this very carefully.
The last question for the day is from Zhipeng of Wanbao. Zhipeng? Zhipeng, can you hear us?
Can you hear me?
Yep. Go ahead.
Hi, good evening, ministers. This is Zhipeng from Wanbao. We would like to know whether the safe entry check-in system will be made compulsory for all workplaces. Yeah, thank you.
Well, yes, we've announced that safe entry will be made compulsory from the 12th of May onwards, and we will quite soon publish a list of the specific places that will be required to put in place safe entry. By and large, all workplaces, when it's a factory building, it's an office building,
Just to respond again to John, who had asked that question, I hadn't that information at that point in time. There were 20 persons infected with COVID-19 infection who unfortunately have passed on. 4 of these individuals were nursing home residents.